reduce the cost of health in this country, because it has come to our attention as a committee that as most hospitals are charging exorbitant fees. You take someone to the hospital, within a week, the bill is $1 million. So the question to the committee, what is the government going to do? Part of the effort that the government is putting in place is universal health care. So then it gathers for the medical for people who have no capacity. Now, I think in terms of way forward, we are going to direct that the ministry and NHIF, we're giving you 21 days. Because you've requested for 30 days, we're giving you 21 days to ensure that within those 21 days, you engage all the stakeholders in the sector and come up with a working report. And the report should be tabled back to the committee within those 21 days. Meanwhile, we also expect you to continue with your program that you've put in place to ensure that the services that are very important, the health services, are not interfered, both in government or public and private sector.
We are children of the same mother, if not one father. Same mother, means of health, even if not the same father, we could be adopted. So because of that, the formal consultation seriously, which affect every Kenyan, including the one speaking, we can have a formal engagement where the NHIF board and the Kenya Medical Practitioners and Dentists Council board sit together, not where you are inviting me to send a representative to a meeting who will go and have other mixed grill discussions. So we can have a special council meeting together with NHIF. We can even afford a retreat together. Then we address this issue of pricing. Because if I'll get it from the media, I'll get it from a gazette notice, I'll get it from a patient, it will not be intensive consultations. So for me, I'm talking of consultations and the consensus building. I would like to assure members of the public that as the chair of the technical committee that has been working to review the cost of healthcare in this country, we have had all-inclusive stakeholder engagement, and that the findings and the recommendations of this committee, technical committee, have been presented before the National Assembly Health Committee. Now with the further directions that we finalize and we give the final output, we shall convene the final committee to adopt and make final recommendations for implementation by the National Assembly Committee.
Let us get all these stakeholders and let the standing committee be there every year to renew annually. There's another one they need, a claim procedure. We also need a committee that will look at the claim procedure.
All we asked for was engagement prior to this crisis that was pending. And so at the moment, we have got in place some agreements in place in terms of we negotiate, in terms of the new contracts, both their content and in terms of pricing, in collaboration with all other stakeholders. And as discussed with the Ministry of Health and NHIF, all services will continue on the previous rates until the 30th of June. By that date, we trust that we will have gotten an agreement in terms of what new rates will be in operation, so services should continue uninterrupted. Thank you.